This is a time when the U.S. seems to be doing better this time because of lots of vaccines have been applied to people. So I think the U.S. is in a much better position right now in terms of school reopening.
And compare that to how it was when things first started.
When the things first started, really people were caught off guard, and it was quite a bit of chaos at that time. Right now, I think we are in much better position to get schools restarted because of the protocols that has been put in place and the guidelines from CDC have been adapted to the current situation, and lots of vaccines have been applied, especially in smaller cities like ours. That there are more people being vaccinated compared to the larger cities when people are still um, back in line. Yeah.
Now, obviously, a lot of sectors had to battle with the same things, not just the virus, but also the variants and, sort of getting testing up to speed, getting vaccinations up to speed. And obviously, there was that slow initial pace for the vaccines. But specifically for schools, what would you say have been the biggest barriers to reopening, not just for students, but for teachers as well?
I think there's lots of stakeholders in this reopening initiative because some parents are against their kids wearing masks, or some parents are concerned about their kids going to school in the first place. And there are unions that are against school reopening. So there are lots of political factors that are affecting the school reopening. So the school reopening has been very much politicized. In my personal opinion, it should be more educationalized, so to speak, if there is such a word. People should think more about the educational implications of schools reopening. For instance, how do you just adjust the modalities? Is there a possibility to micro pivot to the online format in case some students are just found to be infected?
And so, as you mentioned some of the political things, what about some of the physical things that are actually needed for schools to be able to reopen safely? A lot of them having to sort of reorganize classrooms, introduce new sort of sanitation and cleaning methods. Talk more about that for us.
Yes, I think that kind of physical things have to be done to ensure the safety of students. I know that CDC has adjusted their safe distancing requirements from 6 feet to 3 feet right now. So that means students are going to be in greater proximity towards each other. So that is posing higher risk if there's some students who are infected or if there is a variant that is coming into place. So that is one of the things that people have to be concerned about. But if you really think about it, 3 feet is usually our normal personal distance before the pandemic, because that's usually how we maintain our personal distance from each other in normal times. So it is going to be a little bit challenging if there are some infections going on there. So schools have to be very careful testing students, and I would rather that students who have received vaccines, I mean these high schoolers especially who are above 16 of age, and if they have been vaccinated, I wish there's a method to track that so that schools can have a better idea how to do this. And students sometimes lose their vaccine records. Students being students, they sometimes lose it. I wish there's a digital way for students to track it, some QR code, or if there is a digital record by the school, that would also be helpful.
And you raise an
Another thing
interesting point. You raise an
yeah,
interesting point because a lot of schools obviously had already required vaccines for different conditions in order for children to allow to go to school. But a lot of people are wondering, is the COVID vaccine one that you expect both teachers and students may perhaps eventually have to be mandated in schools?
I think you can mandate it in higher ed because most people are just above the 16 years of age to be able to receive vaccination. But if you're talking about K through eighth, or if you're thinking about even younger kids, pre-K, it is very difficult because science hasn't told us whether the vaccines are safe for these kids. and what kind of vaccines are safe and for what amount of the vaccine should be applied to the younger kids. So that is going to be difficult to be mandating this. But I'm wondering if at the high school, when some students are above 16, if people have received vaccination, if there's going to be a record of that, and if teachers can track that, or if there is a testing going on because of FERPA and other law, students cannot announce this. But I just wonder, if there's some method to the madness. Otherwise, nobody knows whether there's enough students being tested in class or vaccinated in class.